Hello everyone. Today we will continue the series of solving previous question papers. So in paper 1 of Jan 2025, question number 5 was asked about coronary circulation. Coronary circulation. So we all know that we don't usually like questions over anatomy and physiology. But the thing is, in paper 1, it is always expected to get questions from basic subjects. So what we'll do is, we'll try to simplify it and try to understand so that we can remember and write the answer for this question. First of all, to write some introduction, this coronary circulation is something special. It is also known as vasa vasorum. And next important point is, we know that all our organs will receive blood supply mainly in the systolic phase of the heart, but these coronary arteries will receive their blood supply in the diastolic phase. So these receive blood supply in diastolic phase. Then another important point about coronary circulation is, though they are not end arteries anatomically, that is, there will be some form of anastomosis in this network, but they behave functionally as end arteries. That is, suppose there is a blockage, the tissue will get ischemic or necrosed because of the low caliber. So we have to remember this. Functionally, they behave like end arteries. So this is mainly because of the low caliber. So this is a small introduction. Then we will deal what are the branches and how it will be supplying the heart, supply proper, and some clinical significance. So this will be the pattern of answer. Coming to the branches, in this one, a schematic diagram need to be understood first. So here what happens is, we know that aorta, ascending aorta will be out like this, right? And immediately after the aortic valves, we know that aortic valves are tricuspid, semilunar valves. So there will be like a 3 cusps, okay, at the aortic valve. So aortic valve is at this level. So immediately over it, where ascending aorta starts, ascending aorta start. Here there will be 3 dilatations. So we can observe 3 dilatations in relation to these 3 cusps. So it will be like this. It will be slightly dilated at the base of ascending aorta. So these are called as, these slight dilatations are called as aortic sinuses. So these are called as aortic sinuses, also named as sinus of Valsalva. Sinus of Valsalva. So we can see one is right, one more is left, and one more is in between. So from these sinuses will be the origin of mainly 2 coronary arteries. One is right coronary artery, one more is left coronary artery, and one more sinus will not give any branch. So this is non-coronary sinus. So here is the origin, right? So we will discuss each one of these now. Now coming to right coronary artery, we got to know that origin is from the right aortic sinus. Aortic sinus. This is the origin. After its origin, the course will be like this. So if we consider the course of right coronary artery, if we consider here as right atrium and the auricle with pulmonary trunk here. So, and we can consider right ventricle here. So just a schematic representation. it has originated here, it will come in the groove between right atria and right ventricle. So this is the first spot. Then what it will do is, it will descend down over the anterior surface of the right ventricle, and it will slowly reaches the inferior wall. Then it will take a turn in the posterior aspect, and it will ascend up to end at a crux. End at the crux. Crux is nothing but the junction of interatrium, interventricles, and atrioventricular junction. So the site where all the four chambers will be meeting is called as crux. So it will end it here. So if we label the numbers, first one is in between the atrioventricular groove, then over the surface of the right ventricle, then mainly it will go in the posterior aspect, and finally it will end at the crux. This is the course of right coronary artery. So what it will do is, while passing through all these pores, it will give some branches. So those are very, very important. So what are the branches? Branches of RCA. So immediately after origin, it will give a branch to the pulmonary trunk. Then it will give a branch to SA node and to the right atrium, and even AV node. So these are the important structures here. And while descending down, it will give right-sided anterior ventricular artery, right-sided anterior ventricular artery, and right marginal artery. And it takes a turn at the posterior aspect, and here comes very, very important branch. That is, in the posterior aspect, it will give septal branch. That is, it will mainly supply posterior 1/3 of interventricular septum. Why is it so important? Because whatever the artery which supplies this posterior aspect of interventricular septum is called as dominant circulation. So here, if RCA is giving the branch, it is called as right dominance. So this is seen in 80 to 90% of the individuals, and in other 10 to 20% it will be left dominance, which we will deal when we discuss about left coronary artery. So now it has reached the interventricular groove, and finally it ends at the level of crux, and during this course it will give some supply to the left ventricle also. So if we consider the supply of right coronary artery, it will supply very important electrical segment of the heart. So mainly it will supply SA node, AV node, right atrium, right ventricle, posterior 1/3 of interventricular septum, and right bundle branches. So these are the structures, and mainly inferior wall. Inferior wall. So we can imagine the clinical significance here. So if there is occlusion in right coronary artery, mainly it will lead to inferior wall MI. It can lead to right bundle branch blocks, and even because of pacemaker involvement, there will be heart blocks or bradycardia. Bradycardia can be seen. So this is the importance. And coming to dominance, why is it so important? Because in population studies, they have observed that right dominance will give a better prognosis in some cardiac procedures compared to the left dominance population. So that is the only clinical significance of deciding dominance of coronary circulation. So this is about right coronary artery. Just to sum up here, it will take origin from the right aortic sinus, and it will descend in between right atrioventricular groove. It will come down, and at the inferior surface, it will turn upward and pass in the posterior aspect, supplying the posterior 1/3 of the interventricular septum, and finally it will end at the crux. So this is about RCA. Coming to LCA, left coronary circulation or left coronary artery. Now we know that origin is from the left aortic sinus. Okay. After its origin, similar to RCA, this will mainly run in the posterior, in the left side. So this is the left atrium with auricle, and this is pulmonary trunk and left ventricle. If we consider, after the origin, it will descend down, and immediately what it will do, it will give a circumflex branch. Then again it will descend down. Here over its course, it will give two important branches, will descend down supplying the left ventricle, and coming to this circumflex artery, it will give another branch which will run at the left side margin. So to name them, this is left circumflex coronary artery and this is left marginal artery, and the one which is descending down here in the anterior surface mainly is LAD, left anterior descending artery, and it will give two branches, one is diagonal and one more is septal. We told that this septal branch will supply anterior 2/3 of interventricular septum because posterior 1/3 was supplied by the RCA. Suppose this septal branch covers entire septum, interventricular septum, then we can consider it as left dominance. Left dominance. So this is the thing, and the clinical significance, we know that occlusion of the left-sided vessels will be more severe and more life-threatening compared to right coronary artery. And we know that proximal LAD is a critical condition. Even the left circumflex coronary artery, if it gets blocked, there will be a large area of left ventricle which will get necrosed. So this is the importance. And we know that if proximal LAD is occluded, it directly needs bypass surgery. So this is the explanation about left coronary artery. This will be the course and the branches and their clinical significance. Hope you got the point of coronary circulation. So it is very important and very easy. Just understand these schematic diagrams and you will get the point. Thank you so much. Meet you in the next video.